Hello everyone, and welcome to And Sleep. My name is Tommy Licatese. I have the pleasure of hosting allergist Dr. Clifford Bassett. Today we'll be talking about seasonal allergies and sleep. Welcome to the program, Dr. Bassett.
Great to be with you again.
So what is allergic rhinitis? Can you describe what hay fever is?
So rhinitis is inflammation, irritation of the nasal membranes, the nose, the sinuses, and basically what's happening is allergies are coming along. They're causing an event to occur, an allergic event inside your nose, because of your predisposition to have allergy or not. We call that atopy. Pollen comes in, dust mites come in, pet dander comes in, and there's a variety of things that go on. Histamine release and other chemicals, simply put, and they cause itchiness, sneezing, puffiness of the eyes, respiratory symptoms, clearing the throat, postnasal drip. These are all examples of allergic type symptoms.
And how do these affect your breathing? How do all these, how does hay fever affect one's breathing?
Well, certainly sneezing, runny nose, obviously a lot of that's physical appearance and annoyance. With the tissue box, I have patients that come in, they say, I went through a tissue box in 2 days again, so they kind of mark themselves in terms of their behavioral activities. But the bottom line is nasal stuffiness is the most important and bothersome symptom when it comes to allergies in children and adults. Number one, nasal congestion. Antihistamines are great for sneezing, itchy eyes, watery eyes, and so forth, but they don't touch congestion and stuffiness. For that, we have special nasal sprays for people that need medications, both over-the-counter nasal cortisone, over-the-counter nasal antihistamine that work well for congestion and stuffiness, but you have to use them. And so if you have symptoms for a period of time, you cut back on it. The most important thing for me in the springtime is nasal priming. If you start early, 2 weeks before the season kicks in, how do I know? Because I'm testing them and I know their allergy portfolio, their allergy equation. We start early, we start using medications, nasal sprays, anything that will work, even nasal saline, before the season kicks in. As the season goes down, weeks into it, you're gonna feel like the medications aren't working because the smallest amount of pollen is needed to get you into an allergy attack. So therefore, if you start early, we can often pre-treat and sometimes prevent allergies. So we really try and act smart and teach our patients to be allergy savvy.
Patients are experiencing now nasal congestion. Can you describe the importance of nasal breathing versus mouth breathing?
Nasal breathing is how we were made. Breathing through the nose, we're humidifying, we're filtering, we do all the things that the nose is supposed to do. Once your nose is clogged, so to speak, or congested or obstructed, you're going to become a mouth breather. How do you feel when you have a cold and you're breathing through your mouth? You have a dry mouth, you're uncomfortable, you're not getting the proper dynamics for adequate sleep, and that leads to a cascade of events that can lead to sleep disorder. Not necessarily sleep apnea per se, but a sleep disorder that's giving you less effective, less beneficial sleep and less restful sleep, and has an impact on all of us during the day. Drowsiness, falling asleep, drowsy driving, anything at work, both adults and children alike, that affect our performance, our learning, our productivity, and that's quality of life.
Somebody with sleep apnea, would allergic rhinitis or hay fever actually exacerbate sleep apnea or make it worse?
Well, again, depending on the intervention you're doing for sleep apnea, if you have a runny, drippy nose, you obviously want to treat the underlying conditions as well. If an individual is unlucky enough to have a sleep disorder and also have allergic rhinitis, seasonal indoor allergies, sinus condition, or asthma, you've got a little bit more work to do there, and you have to really take time to put the pieces together to enable you to understand what's happening to your body and ways to remedy it safely.
So remedying it safely, how do we do that?
So when it comes to home sleep studies, we perform some, we send some to our colleagues, a respiratory medicine physician, a nose and throat physician. So when people have this home sleep study and other methods of evaluating their anatomy, we get together and talk about solutions. So I take it from the sleep experts. As an allergist, that would be something I refer to them, and they discuss with the patients and families about how to get them back on track. And that may be an oral appliance, it may be CPAP and other things for people that have sleep apnea to a certain extent that it's recommended for their treatment. Not every individual with mild sleep issues will get every treatment that's available. It's individualized and tailored to their needs.
Great. Well, thank you for coming on to the program.
Great to be with you again.
Thanks.